So say you come talk to me and you're like, during my exercise, my feet really hurt or my knees really hurt, my hips are really hurting, they're really tight. Maybe you recently got injured and there's a lot of swelling, so maybe you like a hamstring or strain your quad, strain your lower back. Something is impinging your hips down. So somewhere from the tips of your toes up to your hips. Use your imagination for this. Are you stiff? Are you tight? Could you be stronger? Could you have more range of motion? What we're going to look at doing is repairing your squat. So I want to lead you through, guide you through what is an example sequence. And we're going to make this as simple and also relatively quick as possible. So just an example sequence of we need to repair your squat in order to fix up your ankles, fix up your knees, fix up your hips, right? So what do we want to do with this? We want to test the squat first off. So let's look at where are the restrictions? Where are you incapable of moving so that we can have a very clear, a very observable, a very measurable, a very repeatable thing to look at that actually says, hey, my squat looks like this. Maybe I can't go down all the way. Maybe my knee's really painful. And then I do this work and then I go through the squat again and hey, suddenly things are objectively better. That's how we know we're making progress. We can't rely just on pain, yes, no. Is it performance? Better, yes or no? That's what's important. Is always dial it back into performance. To can you breathe better? Can you perform better? So how are we going to do this? Test position, find something to massage, find something to distract, find something to floss, and then retest. So really short and simple. This is non-exhaustive, loads of other stuff again, but this is an example sequence that you could try. And we're going to go through the whole sequence, and I've got my watch ready to make sure that I'm sticking to about 2 minutes per drill. So what you're going to need, guys, massage therapy ball, voodoo floss, and a resistance band. We're going to go ahead and set up the resistance band on something like a squat rack, something at hip height. So I'll put that there. Actually, no, this is going to be low. We are going to be using this on the ankle. So I need it at about foot height, or as low as you can get it. Go ahead and put it there. So starting off, we want to test your squat. What we want to look for, 3 big things that I look for when we're squatting. We're squatting for mobility. How you actually squat when you exercise might slightly veer off of this, but we want to apply some strict gold standards so that we have quality mobility points to look at, points of performance with mobility. Feet ramrod straight, and that's usually where people are like, oh no, you don't squat like that. For this sake, yes you do. Feet or ramrod straight, as if you're on skis. They are perfectly straight ahead. They are not turned out even 1 degree, and that's so that we can more accurately measure your ankle rotation, which is coming up. As I go down into my squat, actually, let me back up. Squat width, how wide is wide enough? This is something that nobody can tell you. It has to be here. It has to be directly under your hips. It has to be just outside hips. Most people, I find, squat most comfortably with their feet just slightly outside of their hip width, but you play around with that and you find what works best for you. It also depends on your restrictions. So a couple of things. Let's just say that I have a really tight ankle. Maybe I sprained it playing football the other day, for example, or it's been 6 months and it never healed quite right. It's still a little bit swollen. I still have a slight limp and now my hip is hurting, my lower back's hurting, and that's impacting my ability to sleep. And now I'm waking up my partner in bed because I'm rolling around a lot because my hip hurts. And now because my sleep is aggravated, I don't feel as good going through my day. I can't take care of the kid as well because I'm just bloody exhausted now. And being at work just is miserable. Let's just apply some context here, right? So feet are straight. As I go down into my squat, I want to think about taking my butt back first. So my butt's going back. I don't just go straight down. Notice how that looks like knees going forward first. I want to move my butt going first. So feet are ramrod straight. I take my butt back and then down. So I'm not going back like deadlift, back as far as I can, keeping my torso straight. It's not that far. So it's going back like this. I kind of go diagonally, really. As I'm going down, I'm simultaneously with these ramrod straight feet, letting my knees go out. And it's just gently going out. I don't want to be pushing out so much that my feet turn out. I keep my feet in place and I let the knees go out. So those are the things that we look for here, which is that I'm keeping my feet straight, I'm shoving my knees out, and I initiate the movement with my bum. So what we often see is that because I'm affecting the ankle, what we often see is that there's an inability for the ankle to spin. Your ankle doesn't just move up and down, it also turns. If I'm lacking rotation, I lack capacity for creating power through my butt and my hips, so I'm going to be a much weaker athlete. Simultaneously, I'm going to have a lot of circulatory restrictions. So blood flow is not going to be great. Things are going to get stagnant. Things are going to get more painful because of that. So let's do some work to undo that tension. So what we're going to do here, guys, we want to increase our ability to squat. So let's say I go down to my squat and this ankle's coming up because it has no real range of motion and it's just really tight and that feels awkward. I can't go that low. What can we do to fix this? Number one, we're going to start off with the massage ball. So we start off with massage work, then we're going to go to the band, then we're going to go to the floss, then we're going to go to the retest. Starting off really easy, we're starting to affect the ankle. I'm going to begin just with simple calf massage. So moving this down, up and down, side to side, all over my calf muscle. I want to take 2 minutes. So literally we're going to go 2 minutes through this, 2 minutes through the next drill, 2 minutes through the flossing. So if you just want to see the drills, if you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond and I am a strength and rehab specialist. I work with people who want to return to sport and fitness but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start. You can fast forward through this. If you want to follow along and actually do this with me, which I do highly encourage you to do, please do. So fixing the squat in relevance to the ankles. The ankles are usually, and that's the reason why I decided to do the ankles for this video, for this freebie up on YouTube, on social media, is that the ankles are usually the most obstructed part of people's anatomy when it comes to squatting and leg health. Typically, I find that even if people are overweight, relatively weak, having some pain, their knees are usually fine unless it's an immediate knee injury, and their hips are usually fine. It's usually the ankles that are so freakishly stiff and have so little capacity for rotation. People will be stuck squatting with their knees directly over their toes and they have no capacity for spinning the knee. Now, why do we spin the knee? Why is it so important that I can create that spin? That's creating torque. Torque means rotational energy. If something is moving in a circle, if it's rotating, you can measure that rotation with torque. And that's how we talk about it with squatting. Knees out. It's not so important how far the knees are getting. The point is that you're able to generate enough power to prevent your knees from collapsing. It's about creating stability, right? We're all familiar with seeing, it's most common in women that you actually see it, it is. But when you see people, they squat and their knees collapse inwards, and sometimes even they reclaim the position on the way up. We want to avoid that position as much as possible. That's what we call a knee valgus position. Basically, the knee is shearing to the inside. Now we're only doing this on the one side. We're coming up to 2 minutes. And what we're gonna do next, guys, so we've spent 2 minutes just massaging out the calf all over, from the bottom of the knee all the way down towards the heel. What we're going to do next is massage out the side of the hip. So when I'm actually creating this rotation, you're largely using the external rotators in your butt because you have dedicated muscles whose sole purpose in life is to create this external rotation, to create this power, because that's what allows me to stand upright. So ideally when I squat, I can generate this external rotation to bring my hips in, because this stuff, it exists to stand me upright, which is what you're doing when you're deadlifting or when you're squatting. But if I go a little bit more to the side, I have a muscle here called the tensor fasciae lata. I'm going to put this up into a wall. So I'm just getting here because I want to stay in frame of the camera. But here, basically, how do you find this? You find a picture of it. I'll put a little picture in the side of the video here. TFL, if I go for a walk and I put my hands on the sides of my hips, I can feel a muscle tensing right in front of my hip bone there. So if you find the front hip bone, your ASIS, your anterior superior iliac spine, I just say that because I know the name. If I go right behind it, it's there. If I find the greater trochanter of my femur here, it's just kind of diagonally above and in front of that. So find where that is tensing, and don't worry too much about finding the exact spot. Basically, we can say massage out the whole side of your hip. Make that super simple, make that super easy. And I want to spend 2 minutes getting in there. Now, what I like to do for this, when we're massaging out muscles, guys, we want to put the muscle into as relaxed a position as possible. If I'm actively tensing the muscle, well, that's a little bit contraindicated. And by a little bit, it is contraindicated. You should not be doing that. Why? We don't want to be tensing something when I'm trying to relax it, right? So if I'm actively trying to, I don't know, stretch my bicep, I don't want to be contracting my bicep. I'm like trying to contract it. That's not going to let it extend so much, all right? So if I'm here, if I'm in a position where my hip is having to support itself, the muscles are tense. Now I'm trying to massage out tense muscles. That doesn't work. So I like to come up onto my toes. I know you can't really see that. Let the knee bend, and I put my body weight onto the other leg as much as I can. And now my hips bent, my knees bent. My TFL there is so relaxed. Whereas if I step fully onto that foot, it gets tense. Now I can't go in as deep. So you just have to fiddle around. Never be afraid to play around with position. I've had so many people be so concerned, like, doing it right. Is this in the right spot? Is it in the side of your hip? Yes? Perfect. That's all I care about. Is your hip relaxed? No. Relax it. Get into a position where you can relax it. Is it relaxed now? Yes. Bloody good. Is that the expression, bloody good? Jolly good? Whatever the Brits say. Right, so moving that around, typically, I can even use it like this to relax my body even more easy. About 30 more seconds, guys, that we're driving that in there. This is how long it takes. Make sure, guys, that you're also breathing really deeply and slowly and through your nose. Don't open your mouth during this. People always want to speed through. They both want to go really fast in an area, massage that really fast and spend like so little time in an area. You got to go slow to really depress the nervous system and get things to relax and chill and hydrate. Okay, that's 2 minutes there. How easy is that? Massage out your calf, massage out the side of your hip. Easy. Next up, so that's going to help us create more rotation and have more power for that. But now we actually want to open up the ankle bone, the ankle joint itself. So create that distraction of pulling the ankle around. This is going to be 2 minutes, bang. So I put the band across the lowest part of my shin bone. So it's right on top of the ankle. And I'm going to pull this out far enough that it's tight. The band is tense, the band is tight. If I were to lose my footing abruptly, I'm getting yanked back. It's trying to pull me. It's trying to pull me all the way back here. So I pull that out about a yard or so out, and all I'm going to do, this is really super simple. I'm creating little knee circles, and I'm trying to exaggerate my ankle range of motion as much as I can. Now, it may not look this far for some people. That's not far for other people, but I just want to move that through, creating as much rotation as I can. So as I'm doing this, I'm going to spend 30 seconds in each direction. So we're coming up on 30 seconds. What I'm going to do now, it's been pulling the front of the shin back. Now I'm going to turn 90 degrees so it's pulling the side. So it's pulling to the outside. And we're going to do the same thing, just creating knee rotation. So simple, so easy. People don't have any real excuse to not just get this done, get this in. So if you have really tight, weak feet, do this. You will have tight, weak ankles. This is going to help to actually open up. So we're actually working to spread out the bones of the ankle and the shin, to pull them apart a little bit. We're coming up on 30 seconds. So 3, 2, 1. Turn 90 degrees. So you should be facing wherever your band is anchored. So the band's pulling around the back of your ankle, and that might be on your Achilles tendon. That will be on your Achilles tendon. That can be uncomfortable. So adjust as you need to, or just skip this one altogether. But if we can really get the bones to open up, get things to be able to move a lot more, you have more capacity to create strength, to create power. And final 30 seconds, turn. So now it's pulling the outside, pulling in, or maybe to the inside, pulling out, depending on which direction you move to begin with. And just create those knee circles as best you can. 2 solid minutes pulling your skeleton, helping to open up. Normally, if I'm actually working with a client, we would retest the squat, or you might even want to test your pistol position. We're coming up on 30 seconds in 5, 4, 3, 2, and 1. Now, how easy is this therapy session so far? So we've tested our squat, we've tested our ankle range of motion, we've massaged out our calf, we've massaged out our side of the hip. Now we distracted our ankle, we helped to open it up. Normally I'd have someone actually go into a squat again, and you can absolutely do that. And even having a full range of motion squat, I can still feel the difference massively. I feel like I can spin this knee out so much further, and that means I have a lot more room to play around with, a lot more capacity and potential for strength and power, because I can create more contraction through the hip and create more rotation. I can create more torque, because when things get heavy enough on my back, it's going to cause a collapse. Things will either bend or they will rotate under the pressure. In this case, my knees will bend, my femurs won't bend, but because they're a ball and socket joint, they will have a tendency to rotate. I can either create the rotation myself or nature will, and that means my skeleton, my ligaments are taking the stress for me. I don't want that. So next up, you'll notice as well, I'm only doing my right foot, my right side during this. I do often take people through a sequence completely on one side, then we can really feel and see the difference, and then we do the other side. So next up, we want to use the voodoo floss on the foot. So I'm gonna wrap this up around my ankle. If you need a refresher, I have a dedicated video talking about wrapping the ankles. But I wrap that up. Remember to avoid the heel. I find that there's no real benefit to wrapping the heel itself, and I'm wrapping it tight across the back. Normally you would want to take your sock off. It doesn't really matter too much, but take your sock off, do it on the skin, and then I wrap that through. So what are you doing here? 2 minutes. I should probably take off the other shoe as well, just for walking symmetry. I would go, typically what I'll do is that I'll go for a walk, and as I go to step the flossed leg, I kind of pick it up and extend it through a lot of ankle range of motion while it's going through the air. So I really go toes down, and then as I step it forward, so I'll go this way. So I really take toes down, and then as I bring it forward, I'm really trying to pull my toes up. I can go into those same knee circles that I was doing while I was doing the banded distraction. That's pretty easy. I can try to roll my ankle out to the side. Ooh, that almost feels like something needs to pop, but in a very uncomfortable way. I'm not going to touch that. And that's fine. You'll feel things like that. Hinge your body over, grab onto something, and go almost like you're doing yoga when they're doing the downward dog thing. And they're putting their legs in that position. You can do a similar sort of thing, or just simply hinge over in this and copy what I'm doing. That's easy enough to say. About 45 more seconds. And of course, practice squatting. Just move. You're just creating movement. And move, and move your ankle, move your toes, move your knees. Just move around. You can keep it really simple and just simply pump your ankle up and down. This stuff is so simple. People often just want like really complicated stuff. And I've actually had a complaint of giving someone 20 seconds to go, some work to do, and they're like, that's not difficult. Why does it have to be difficult? Why does it have to be complex? It's usually the simplest, easiest things that are most effective. And it definitely is. Like these few drills, man, do this every day for a week. You're gonna see a massive difference in your ability to run, your ability to squat, your ability to perform. And to have less pain, less swelling, less stiffness, less tension in your body. Now we take this off. That was 2 minutes. All right, so those were the major drills. Again, there's loads of other things that we can do. So we can mix and match, go through my other content, make sure you're moving your foot around as well, and add in other drills to do in between those things. But those are some pretty major drills that will help out most people. So you can go through this sequence. Remember, I'm not a doctor. You do this at your own discretion. You take full responsibility, full liability for all your stuff that you're doing. I'm just providing suggestions, not medical, anything. Don't know why anyone would think this is medical care, but that's a disclaimer that you have to have. Anyways, and then retest your squats. So remember, feet going forward. I'm not wearing my shoes, so you might want to put on your shoes to have that extra traction. The traction helps you to create torque because it creates more of an anchor for your feet. And try to spin those knees out and just see how it feels. Take pictures of yourself when you're doing this. See how it feels. Yeah, that's it. How long did that take? Not long at all. I would then, of course, want to do the other side to make it symmetrical, even if the other side is not problematic. If that's the case, maybe just don't do as much work, just maybe 1 minute on each bit. Super easy. Let me know if you have any questions or if there's anything that you want like more specific help with. Let me know. I'll be happy to help you guys out. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.